essence of this trip, first of all, is to provide parliamentary oversight. All you see here are honorable members of the Health Select Committee of Parliament. And constitutional mandate, among everything, is to provide thorough oversight on everything that is got to do with health within the confines of this country. So we were here today knowing very well that COVID is around. We want to understand the developments at the international port, which is a major port of entry. Most importantly, our ranking member about 2-3 weeks ago issued a statement, and that was the worry of Ghanaians at that time of the high rate of reported cases of COVID for passengers arriving in Ghana. We were on recess at that time. That was about 2-3 weeks ago. We came back to Parliament yesterday, so we thought it as a responsible committee of the people and for the people. We must come immediately to understand the dynamics and what is the situation as of now. So we came in today and we have gone through the processes from arrival before you take your luggage and you exit from the airport. And that to us is a core responsibility of ours, and it's ably discharged this morning. Thank you.
So far, I can say I'm impressed about the processes. It's not perfect though. I have one or two reservations. For example, how the port officials come into contact with the passengers before the passengers know whether or not they are positive. That's a worry, and I believe from here we'll have some interactions with them, and then we'll ponder over it how we can adequately resolve that one. And then we are yet to also find out whether or not the reported cases are declining or increasing, because as Chairman indicated about 3 weeks ago, we had this increasing number of positive cases arriving in the country. So we will also have some interactions with them, measures that has been put in place to also curb that phenomenon. And so for me, in general, I think it's not bad. The observation, it's impressive.
Just to add to his position of it being impressive, I think the processes, the operational processes are what he's talking about, that we are impressed with the operational processes.
Once anybody who tested positive, apart from being detained, you also get the sequencing is done for all those who are positive and detained, so that we'll be able to pick up that. Apart from that, we are doing random sequencing from our labs to see the kind of variants we have in this country. But I must tell you that this antigen test, FDA has done a test between that and PCR. It is very, very, very comparable. Secondly, antigen test picks the disease when it's very early. PCR may miss. And that's why for airlines like KLM, when you have a negative PCR 4 hours before you fly, we do an antigen test because that is more sensitive when the disease just started. And so we believe that based on our assessment that we have done, those who have detained and we our own research check to see with PCR, it's almost apart. Those who are positive are almost always positive with PCR. And for PCR and lab tests, please, if you are not using the same sample, it's difficult to compare when you are taking different samples to compare that one. If you take the same sample and you are testing between two systems, that's more accurate than taking a sample here and a day later you take another one, you want to compare with the first one. So I think that's what we need to understand. But I think we need to clear some policy guidelines to ensure that once you are positive, you go through the processes. And there are times on the third day you will be retested.